Hello and welcome to Bookimed. I am Anna, a doctor coordinator here, and today we have a special guest to help us to explore the world of stem cell therapy. Our goal is to help our patients understand this complex treatment in a straightforward and accessible manner. I am pleased to introduce Dr. Isabella Bernaschina, a leading expert in regenerative medicine. Dr. Bernaschina has a deep experience in stem cell therapy and works at the Medical Center Planta in Playa del Carmen, Mexico. She has a master's degree in regenerative medicine and is highly respected in her field. Dr. Bernaschina specializes in using stem cells to treat various conditions, including joint problems, diabetes, and even for rejuvenation. She's here to answer common questions of our patients and explain how stem cell therapy works and how you can expect from them. So let's dive into the interview and learn more about this exciting treatment. Hi, Isabella.
Hi, Hannah. Thank you. Thank you for the interview. I am Dr. Isabella Bernaschina. I'm a specialist in regenerative medicine, and I'm so glad to have this interview so we can explain more about regenerative medicine.
Exactly. As we have a lot of patients who are interested in this treatment, but they have so many questions, so this video will be very helpful for us.
Of course.
Super. So we can start.
Okay.
Isabella, our first question will be, what inspired you to specialize in regenerative medicine and stem cell therapy?
Well, I think that even if I'm a doctor, I don't like to take a lot of medicine, because medicine always had some side effects. So if they try to fix the problem in this side, but then we can have more problems through the other side. So regenerative medicine is the only medicine right now that really can heal the problem from the base of the problem. I mean, it's very easy to understand. Our body is done by cells. I mean, anything in our body is cells. So any kind of problem, of issue, of disease in our problem is a cell damage. That's why regenerative medicine goes to fix the cell damage. So it's not like normal medicine that just try to take off the symptoms, but it doesn't really heal the problem. That's why I decided to enter in this field.
Yeah, I think it will be like developing with time to time, and very soon it will be like very popular. A second question, which I always get from my patients, they always ask me, can you explain how stem cell therapy works? What makes them different from other cells?
Okay, stem cells are new and healthy cells that we own produce. Our body produces stem cells from from we born until 25 years old. We have the most production cells. Then we keep on production. We keep on produce stem cells, but the level of stem cells goes down with the age, with maybe some illness or our lifestyle and so on. So we use stem cells we put stem cells in our body by the therapy, by the regenerative therapy. These are new cells and healthy that go to fix the problem in the cells that they're damaged.
I see. Which conditions can we treat by stem cells?
Okay, this is a question that the answer is might appear weird, but almost everything you know, because as I told you, any issues, any disease is a problem, is a cell damage. For example, if you have a problem in the liver, your liver cells are damaged. If you have problem in kidney, your kidney cells are damaged. They are not working properly. So I know that it sounds crazy, but almost everything, you know.
Mm-hmm. Good to hear. Very often we receive patients, they come to us and they ask which, for example, knee problems or herniated discs. So which kind of orthopedic issues is most popular you can treat with stem cells? What is effect from treatment for such patients? And maybe a success rate you can share with us.
If we talk about joints, the stem cell therapy is very, very successful, you know. We have almost two best ways to use stem cells that are by IV, of course, because with the blood they can go everywhere, so they can fix a lot of problems. And in case of joints, we inject directly in the joint. Of course, we have the expertise to do this, because you know, you're a doctor, so you know that a joint is full of a lot of things. You know, you cannot pinch a nerve or something like this, because of course we are very, very prepared to do this. And we used to the most common is knees, of course, because everybody has knees problem. And sometimes the ankle. Mm-hmm. This is another big problem. For example, after a surgery, we can use the stem cell therapy to do a best and faster recovery, you know. In the case of for example, herniated discs, okay, this is the important point. The spine is a very delicate area of our body. So, and is a very irrigated area from the blood vessel. So for all the spine problem, we prefer to do an IV than that pinch directly in the spine, you know, because this can have some risks. So we prefer to use the IV, and we have very good results. The rate I could say that is the 85-90%.
Can I ask you about like how long the result will last? For example, if the patient has a herniated disc, right, and there is no opportunity to make surgery and he has chronic pain, so after injections, how long he will get improvement? Which time?
Okay, usually the time of our body to regenerate are about 2 months. So the 100% of results of the stem cell therapy we can see in 2 months. But of course, it starts slowly. It's not that it's not that one morning after 2 months you wake up and wow, it's not a miracle, you know. So it's slowly, but the 100% of the results are in 2 months. So after 2 months, usually we decide with the patient, we see the improvement, and we decide if he or she can need another injection, or if the problem is fixed, and that's all.
I see. Very interesting and useful information, as for me, as for doctor also. What can you say about neurodegenerative diseases? How to improve these patients with such problems?
Neurodegenerative disease is another field where stem cells are very, very, very good. I mean, we have results about 90-95%, because the neurological cells are very easy to regenerate. It seems wow, but yes, it's very are very easy to regenerate. So we can I mean, I had patients with any kind of neurological problems, since Parkinson, Alzheimer, since when autism is very good for autism. In our clinic, we don't have pediatricians, so we start to treat patients from 12 years old. So we cannot give a therapy to the babies, but the best would be an autistic son. The best would be in the first 3 years of yes, because the regeneration is crazy in this time.
Well, can I ask you, for example, for autistic children, how it will be, maybe there is any statistics, for example, when you get it before 3 years old and after the treatment, will it be different very much?
Well, I have patients of 16, 15 autistic patients, and they have good results. But of course, if you start at 2 or 3 years old, when the baby is still developing, and in these first years of the life, the development is very, very fast. So we can fix more problem if we start in the first 3 years than if we start after. If we can fix problem, because I had very good results, but of course I cannot say that they have the 100% of results if they are a teenager,
I see. What about maybe patients with cerebral palsy or developmental delays? It will also help, like for autistic children?
Yes. Cerebral palsy is another issue that has very good results with stem cells. Very, very good results. In this case is IV, of course, because intrathecal, that means an injection directly in the brain, but is very, very, very risky. So we prefer to do everything that we cannot be safe. We prefer to use the intravenous.
Not to make any additional risk. Yeah. It's not needed.
It's not needed because it works, it works the same. So why to take the risk when we can avoid?
I agree with you. And also complications, maybe because of not stem cells, but just because of way of injections. If we started to talk with you about way of injections, so maybe you can say, I heard about spinal cord injections, or maybe it's not like...
Yes, but in this case, we need, for example, an anesthesiologist who can do the pinch, the injection in the spine. So, I mean, it can be good, but you need a very, very good doctor to do this, and a specialist doctor who do this, who usually do this.
Mm-hmm. I understood. Very interesting, Also, I always and very often we get requests from our patients and questions. So I have chronic ischemic disease, or I have heart failure, chronic patients who had heart attack. So they always ask us if stem cell therapy will help to recover and regenerate their heart muscle and cardiomyocytes. So is it possible for such patients to get this treatment, and is it helpful?
Yes, it helps a lot because it regenerates the coronary arteries and the muscle, the cardiac muscle. So yes, of course, to this patient, we need that they change lifestyle too, because I can give 300 millions of stem cells, but if the patient is keeping a bad lifestyle, wrong lifestyles, I mean, we need the collaboration of the patients too. This is very important, because some patients, they say, okay, but I have the therapy, and yes, but if you still eat bad and don't exercise and drink alcohol, I mean, this is not a miracle. So we need that the patient is committed to the therapy,
Mostly, always it's very important. But for example, regarding stem cell therapy, it's the most important with patients with cardiovascular diseases or all patients which receive this treatment?
No, all patients. Of course, a cardiovascular is a plus, but all patients, we ask to our patient to prepare before to have the stem cell therapy. I mean, there are patients that have a very healthy lifestyle, so it's perfect. But for the patient who doesn't have, we ask if please they can prepare the body to receive the stem cells. However, always when we do a stem cell therapy IV, the day before the stem cell, we do a detox, high oxygenated IV to prepare the body. And then when the body receives the stem cell, the absorption of the body is 100%. So the body can absorb the stem cells properly. This is very important too.
I see. Is there any additional tests or preparations or examinations needed for such patients who are coming to you for treatment?
Usually we ask for a normal blood test.
It's enough.
Basic, yes, it's enough. Mm-hmm.
And maybe for some orthopedic, if joints, scans. Yes,
of course. It depends also from the disease. If they have special analysis, it's better, But usually, if, for example, for anti-aging, we just ask for a normal blood work. If it's joints, we need, well, sometimes we don't have, but we should need an MRI. So it was better for us because we know really the damage, what is the damage. But sometimes they come patients who say, okay, my pain hurts since 2-3 years ago. I don't know what I have, but I want stem cell. It's okay. I mean, we can do it. But of course, we can do more generally, So if I had the MRI, I know where is really the problem. So if it's a tendon or a ligament or cartilage, I can go where the problem is to inject the stem cells.
So success rate for sure will be much more higher.
Of course, yes.
I see. What about patients with autoimmune diseases? Do you have such patients? Do you treat such patients with stem cells?
Yes, I have a patient with lupus, and is very, very, very good treatment. I have a patient who started with me 2 years ago, and she's having every 4 months the therapy with the stem cell and exosome, and she's very, very, very better. I mean, after 2 years, last time that I saw her, it was 2 months ago, and she was almost healthy. I mean, she was very, yes. Even her blood work and all the analysis changed a lot.
Good, very good, impressive. And also very popular, I already mentioned this small subject, but chronic pain. How stem cell therapy can help to such patients?
Okay. The most important property of stem cells is anti-inflammatory property. So for chronic pain, even if we don't know why they have this pain, because sometimes I told you, sometimes I have a very good diagnosis, but sometimes I don't have. So we just do stem cell treatment, but we don't know what is the cause. But anyway, the stem cells heal the inflammation of the body. So the inflammation of the body could be wherever, and this is the cause. Usually the inflammation is the cause of the pain, of the chronic pain. An inflammation process, a chronic inflammation process is giving a chronic pain. So with stem cell, we reduce the inflammation, and of course we reduce the pain.
Stem cell research is often discussed as a possible way to reverse aging. So do you think stem cells could help with aging, and can they reduce the signs of aging? How it works?
Yes, is a very good anti-aging, because I'm sorry because I'm repeating, but even the pass of the time, I mean, the aging process is a combination of damaged cell and inflammation. So what we do, we try to reverse the time, and it's crazy, but it's real, you know. So with stem cells, we take back our body to the condition of 25. I mean, if you are 80, you cannot be like 25, please. But we can do a lot for anti-aging. Actually, all the Hollywood stars and that we see that they are, wow, it looks so young, of course, yes, but they use stem cells a lot.
Wow. Thank you for sharing this information. It will be very helpful for our patients. Which kind of stem cells do you use in your practice, and what types of stem cells are used in therapy? For example, autologous, allogenic, what is the difference between them?
Okay, autologous are stem cells that usually the regenerative medicine was using. They were the first stem cells that they start to use. What is this? They extract your own stem cell. This is the meaning of autologous. Is your own stem cell of your own body. So, if for logic, if you use your own stem cell, I mean the stem cells, if you extract the stem cell from a not healthy body, the quality of the stem cells is not the 100%. This is a very logic thought, you know. That's why 15 years ago, about 15 years ago, we started to use stem cell from donors. This is very better because donors are from 18 to 25. So they have the main production of the stem cells. Of course, the donors are always checked. We use mesenchymal stem cells, and we extract stem cells from the placenta and from the jelly wharton that is a part of the umbilical cord. These women, when they decide to be donors, they decide to be donors at the third month of the pregnancy, and they will be checked all the pregnancy to see, of course, if the stem cells are good stem cells. If they are healthy, they check if they have in a family some chronic disease and so on. So when the woman give birth, they take the placenta and the umbilical cord, and in the laboratory they extract the stem cell. So this stem cell, I'm explaining the process because it's important for the patient to know.
Important, exactly.
So these stem cells, when they are extracted, they send the stem cell to another laboratory. In our case, that we are in Mexico, to COFEPRIS, that is our FDA. So there are some laboratories that they are from COFEPRIS. They check the stem cell 5 days. They take all the tests, all the possible tests, and if the stem cell pass all the tests, they come back to the stem cell bank, and then from here we can use the stem cell.
As far as I understood, allogenic is a donor stem cells, our own body. From which areas of our own body they can be taken?
From placenta and from umbilical cord.
I see. Okay. Maybe you can also tell us how many stem cell therapies have been done at your clinic. Maybe you can share any success stories where stem cell therapy made very big improvement for the patient. For example, you told about your lupus patient. Maybe some other patients you can share stories with us.
Okay. Here in Mexico, we have a huge problem with diabetes. Huge. I think we are the first or the second in the world with the diabetes problem. So Why? Because we don't have a good nutrition. We don't have, a lot of people doesn't have the education to know what eat and not to eat, and we don't have a healthy lifestyle. Well, usually I have it, but usually. So I had a lot of patients with diabetes, and for example, I had a woman who is 74, now 75 because it was last year, and you know that the wound with diabetes are complicated. So I don't know if the patient who is watching this, sometimes they don't know, but when you have the diabetes, when you are diabetic, and if you have a normal wound that you have a cut or something, the healing process of the wound is not the same of a not diabetic person. So in this case, this old lady was, I mean, she had a fit very, very bad. So she had, years ago, she had amputation of 2 fingers in the feet. So this was the 3rd finger, and they come to me because they heard about stem cell therapy. And it was a success, a really success, because we could save the finger, we could save the feet. So and we could load down all the sugar blood. I mean, for example, in the case of diabetes, stem cells helps the pancreatic cells that produce insulin. You know, this is the problem in the diabetes. So with the stem cell are beta cells, we say.
Cells,
yeah,
yes.
you know, okay.
Langerhans cells.
Yeah, so the stem cells fix the production of beta cells in diabetes. So it's very good because the patient could, I mean, again, he had to take care of the nutrition, of the lifestyle, but the patient could produce more insulin, so he can fix the diabetes, that is the main problem.
Yes, they can fix, as far as I understood, all the complications which are caused by diabetes, like microangiopathy, retinopathy, right?
Yes, yeah, neuropathy, yes.
What about, you told me about this patient, so as far as I understood, this is a patient with diabetes type 2, correct?
Correct, type 2. But we can also use in type 1.
Type 1.
Because, yes, because type 1 is an anomaly that the patient have since the birth. So we can fix the no abnormal cells that they have. I mean, the cells that doesn't work from their birth. So we can fix actually the work of how the cells work.
Well, I'm listening to you, you know, and so interesting, and really thank you so much for sharing all this information with us.
A pleasure.
Every patient always asks, what is the average cost of the treatment, and maybe are there any additional or hidden expenses how is it?
Okay, this is very personally, you know, because each case, this is another point. For example, normal medicine, if I take an antibiotic and you take an antibiotic, is the same dose. If we are a grown woman and maybe same weight, it's the same dose, okay? Stem cells is very different because every treatment of regenerative medicine is personalized to the case and to the patient. So we could say we could start from $4,000 until, it depends, until 12,000.
So as far as I understood, it depends on the amount of cells which the patient needs individually, just on it.
Correct. It depends from the dose of the stem cell, from the millions dose of stem cells. So, you know, if you need low dose, it's cheaper than if you need a big amount of stem cells.
Mm-hmm.
And also if you need to complete your treatment with exosomes or placenta implant, of course the cost is different because we need more products, more items, you know.
Can I ask you difference between exosomes and placenta cells?
Okay, exosomes are extracted from the stem cell, from mesenchymal stem cells, and there are little part of stem cells, of cells. They just are important in the connection between cells. So in some kind of issue, we use exosome combined with stem cells because we need that the connection it must be fast and clear, you know, the best quality of the connection. Sometimes if usually the exosomes are used with these patients that they have not a good situation, their body is not ready, is not perfectly ready to receive the stem cells. In a healthy patient, I can use just stem cells with no problem. In a complicated patient, I need to use exosomes to help the action of the stem cells. And placenta implant is another thing. Placenta implant is not IV. Is not we cannot inject it directly in the joint. Placenta implant is extract of the placenta. So can you imagine if the placenta is the organ that build a new body of the baby? Can you imagine in a done body, in a body, you know, the regeneration is crazy. So the placenta implant is in the belly fat, in the two sides of the belly button, and it's just an injection, like intradermic injection, like insulin. For example, I love the placenta implant because in my case that I'm a healthy woman and my lifestyle is healthy, and I'm also a personal trainer, so I work out a lot. I see that the change in my body with the placenta implant are crazy. I mean, the skin, the air, the blood sugar. I'm not diabetic, but you know, I see that when I do my analysis after the placenta implant, it's wow, everything is perfect. And the main property of placenta implant is hormonal balance, both in men and women. For example, in my case, I'm my own patient. In my case, I started with placenta implant during the pandemic because maybe for the stress or for, I don't know, of the lockdown, I didn't have my period for 3 months. And it was like, why? I mean, I was not pregnant, so it was like, boy, maybe. Of course, I had a hormone disbalance, but for example, here in Mexico, we couldn't have a gynecologist assistance or nothing because it was just COVID. So nothing. So I start to do the placenta implant, and after 3 months that I didn't have my period, I do the placenta implant, and 8 days after I had my period normally, like, I mean, not painful, not very abundant with the blood, and it was crazy. So, and I start to see other effects at the energy. I told you the skin, the air, my muscle were different. I cannot explain, but the sensation was incredible. So I do the placenta implant now. From April 2020, I'm doing the placenta implant every 3 months, and this is my wow. I mean, I cannot avoid this because I love it.
Super, really great. Isabella, are there any reasons someone might not be suitable for this therapy? What are the contraindications?
Well, as I told you, we own produce our stem cells. So this is not a chemical product. This is not a side effects product. So it's really for everybody. I mean, they're not complications or people who cannot have the stem cell. It's like you cannot have I don't know, blood. I mean, a transfusion, because it's, I mean, is something that we have in our body. So it's just a plus that we put in our body. But we have stem cells in our body, of course.
I see. So all the patients can get treatments with no any contraindications. Wow.
No,
So
no age. Every age.
also no any age limits, right?
No.
Even
I'm a patient of 85, 86, and I had patient of 10 years old. So
even newborn baby can start with stem cell therapy if there is such pediatrician specialist, correct?
Yes, yes. I mean, stem cell for babies, in my opinion, to avoid any risk, if you need a stem cell therapy for a baby, you need a pediatrician specialized in regenerative medicine. I mean, if I had a baby, I was looking for this because it's different, you know.
Yeah, and you need to have very good experience because
even for example, is a little thing like to put an IV to a baby is not the same that put an IV to a teenage or an adult, you know, or a grown man, because you need to be expert.
Yeah, I agree with you. Even I'm not stem cell therapy doctor, but I agree. What are the possible side effects or risks of stem cell treatment? How do you handle any complications?
Well, there are no risks. Side effects, very, very rare case. Maybe they are disease or something during the IV injection, but this is very, very, I mean, it's very rare. And for this, we just stop the infusion for a few minutes, and then we keep on. It's just, I mean, there are not other side effects that I noted.
Thank you. How do you ensure the safety and quality of stem cell treatment at your clinic?
So the laboratory at the stem cell bank, where we have the stem cells, provide all stem cells dose, every stem cell dose. They provide a certificate of quality. So this certificate of quality had seals of COFEPRIS, of our FDA. So in this certificate, they say that the stem cells are healthy, they don't have bacteria, virus, or nothing, and we can use these stem cells. So they have the seal approval to be used, and every dose of stem cells come with this. Is just I don't have right now, sorry, but it's just a paper where they say that the stem cells are good and safe for the use, for human use, and this for stem cell, exosome, and placenta. So
I see. Isabella, can you describe, for example, if our patient is coming to you, what he will experience during stem cell treatment from the beginning?
So in my case, we offer the whole experience. So we provide, for example, the private transport from the airport. We provide apartments where the patient will stay during the time of during the days of the treatment, and something that that is different from other clinics is that since 2020, when we were in the lockdown, we start to offer the home medical service. So for patients is, I see that I started for the pandemic, honestly, and then I keep on because patients love this, because they prefer to stay comfortable and with privacy in the apartment, and I can come to do the treatment, because honestly they are not I mean, we don't need an hospital to do this treatment, okay, right? Because you can have an IV infusion wherever you want, in your house or wherever you want, and also the joint injection is just a joint injection, so we don't need to be in a hospital or clinic or you know. So we can attend the patient from the patient arrives to Cancun airport until he will be back home. So our patients are very happy for this, because they feel comfortable with this and safe.
And I agree with you. I can confirm it, as I had patient who visited your hospital and he was very satisfied with everything. He left very good review. He told me that he has very good improvement of his diabetes. So yes, it's really amazing results and amazing work of your team. For example, how long does each procedure take?
Well, the procedure, it depends. If it's an IV, it depends also from the vein of the patient, you know, because you're a doctor.
Yeah.
Sometimes we have very good veins. Sometimes we have very difficult veins. So it depends. Maybe from 45 minutes until 2 hours. In very, very bad cases, 2 hours. I'm just talking about very, very difficult case with little veins, or very dehydrated patient, or they have a lot of IV before from some issues, so the veins are very I mean, you can punch the vein or something, but these are very, very rare cases. In normal cases, if we have normal veins, it's 45 minutes to 1 hour.
In general, and from your experience, how you can say how many procedures are usually needed for the best results, or it is also very individually?
Okay, so as I told you, the regeneration process of our body, of our cells, is 2 months. So usually I don't like to say to the patient, you need I don't know, I don't like to give the patient a protocol, because everybody react differently, you know, from the regeneration process. So maybe that with one, if the damage is not so bad, maybe with one time of stem cell you are okay, you are fixed, or usually are from 3 to 6 application of stem cells. But I told you, for example, in my case, I love the results that I have with the placenta. So I don't know how many placenta injection I had since April 2020. A lot. I think a lot. Every 2 months, not every 4 months, sorry, every 4 months. So, and I keep on because I love it. So
This is a kind of addiction.
yeah, it's addiction.
Super.
Yeah.
Isabella, did you have patients who received just one session of stem cells and he was okay and results were good and he didn't need any repeat injections?
Yes. So mostly for joints. If you don't have a very big problem in the joints and it's just inflammation or chronic inflammation or something, with one you can be good. For example, I had a patient with leukemia. That is another totally different, but she had a big amount of stem cells, and after 2 years she came back because she started again. I mean, not like before, but she started to have some pain and something. So she came and she said, I want another one, but it was 2 years. So it was a good time.
You know, every question is, and every your answer is like, wow, and I'm really impressed by this information. Can you tell me, can this therapy be safely used alongside other medical treatments or medications?
No, you can usually if the patient is taking some medication or something, she can keep on the treatment normally, and no, she can do his normal life and taking pills or medication or something. It doesn't interfere with stem cells.
I see. Maybe for your personal opinion, what is the future of stem cell treatment? How do you see the field evolving in the next decade?
Well, in my opinion, because I'm very excited about this, I think that because I use stem cells, I stopped to use to take medicine, so I'm very excited, and I think that this could be the medicine of the future, because I told you, I repeat, I say again, that is the only medicine that really heal and cure the problem. So I hope we are trying to do this. We're trying to inform people and to educate people, and maybe the future is a regenerative medicine.
Wow, hopefully.
Hopefully.
Also, I wanted to ask you, after treatment, how is the progress tracked? Are follow-up visits or additional tests needed? Or maybe you are contacting the patients online, or they have to come to the hospital? How is it working?
We give to the patient every 2 months. We give a call or a WhatsApp, or I don't know, just to check how they feel, and we ask for analysis, because this is the main thing that we can check the improvement. Usually they say, I feel better, I feel this and that, but yes, we used to do a follow-up for the patient with checking the analysis every 2-3 months. And this is very important for us, because I like to have a relationship with my patient, because it's not that they come and they have the treatment and then that's all. I prefer to, because I'm interested to see the improvement, because it's our statistic and our rate. I need it. So we try to have feedback from the patient every 2-3 months.
Yeah, and as you told me that you like to have good relations with your patients, because I can agree with you here. Trust of the patient is a big part of successful treatment and recovery. Yes. So this is very important. Yeah. Is there any specific recovery period after stem cell injections?
Well, if you have IV stem cells, there is no recovery. You can do your normal life. In case of the joint injection, well, I recommend not to do exercise just for 24 hours after the injection, but not for the stem cells, but for the injection, because you are injecting a joint. So we prefer to rest 24 hours, but it's just, 24 hours.
I see. Are there any common misconceptions or myths about stem cell therapy that you'd like to clear up here with us?
Yes, please. There is a myth or a thought in the 90% of my patients, usually from US and Canada, that they always ask about but these stem cells are extracted from abort fetus. Okay, please, this is not legal. Here in Mexico, we cannot do this. We go to the jail if we do this. It's very unethical and illegal. So I don't know if somewhere in the world they do this, but here we don't do this, and we don't want to do this, and we cannot do this. So be safe, because this is, I mean, when I hear this, I'm like, whoa, no, no, this is not possible. Okay, so this idea is totally wrong. Don't think about this. It's impossible. You can be very safe, because we cannot choose this. We cannot do this. This is the main point. I'm sorry, but a lot of patients ask me the same. So yes, this is important. We don't choose abortive fetus. Oh, for God's sake, no, no. It's impossible.
Thank you, dear Isabella. Thank you for sharing this information with us.
You're welcome.
In your personal opinion, so why hasn't stem cell therapy been approved by the FDA yet?
Can I tell you?
Yeah.
Okay, this is a problem of economy, global economy, because the empire of the pharmaceutical industry, of course, doesn't want that people can heal. Because if you heal, for example, in my case, since I started stem cells, I didn't buy medicine like before. So I think that this is the main point. And we have word control, or I don't know. I don't want to enter a lot in this field, but it's an economical issue. That's why the economical empire, like US, Canada, and I think Europe too, doesn't accept stem cell, and the FDA doesn't accept stem cells as a medicine, a real medicine.
Yeah, but hopefully with the time, the situation will change.
I hope.
Yeah. Why should our patients choose Juventa Hospital? What for their stem cell treatment? What makes your clinic unique?
Well, as I told you, I think we are unique for here in Playa del Carmen, maybe Mexico, I don't know, but here we are the only ones that we give the whole experience, the whole medical tourism experience. So, and we try to treat every patient like a friend too. So we try to give them comfort and privacy. We understand that they are not. I mean, they are in a new country. Maybe they never came here. And can you imagine? Even take a taxi and move to go to the clinic from the apartment could be uncomfortable. So I think that yes, the main point that I want to see of us is that we give the home medical service, and this is a high level home medical service. So it's a very good point, and I see that the patients are always very happy for this. And we also offer new treatments combined to the stem cell therapy that helps the regeneration process. So we always looking for new and yes, new treatment for the regeneration. So usually in our packages we combine also other kind of therapy to help the regeneration process.
Great. So our patients can be sure that when they will come, they will be very comfortable in reliable hands, safe, and they will get great results from their treatment. Thank you so much, dear Isabella, for sharing your expertise and helping us and our patients to understand stem cell therapy better. Your insights are invaluable and will certainly help our patients to make more informed decisions about their treatment options in the future.
thank you so much to let me share all the knowledge, because it's very important, and I think it can help a lot of people right now. Thank you.
Thank you also.